Great. Okay. Good afternoon, everybody. I'm Peter Zanoni, Corpus Christi City Manager, and we want to welcome you to today's the City of Corpus Christi and Nueces County COVID-19 update daily briefing that we have with the community and the media. I'll be speaking first today, and then Annette Rodriguez, our Public Health Director, will speak as well. Annette is going to talk about the next drive-through testing that we conduct, which will be tomorrow, Thursday. What I'll cover today is the customary update on our statistics, talking about the number of COVID-19 positives that we have for the Nueces County area. I'm going to give you a status on our first responders. It's been some time since we've talked about them, talk about are there any in quarantine and that type of thing. We want to remind the community of our salute to our public safety first responders and our medical professionals. The salute by lighting the Harbor Bridge, and I'll talk to you about that. And then I'll just remind you of our Texas A&M University Corpus Christi project. And I'll start there, which is that we have a great group of scientists and educators, professors, that are doing some extensive modeling for a 12-county region to include our county, and those 12 counties encompass basically the coastal bend. And we had another conference call, WebEx, with them today, so they're getting ready for Friday's presentation. We know a week ago Friday they presented their first presentation to us and their first projections for modeling that would show our curve to show the number of cases in Nueces County in the region, and the number of cases over time, and how that would eventually come off the high peak and come down to a better level. And so since last Friday, they've been updating the actual model that they're using, or models, I should say, that they use. Every day there's new information given to them and given to world scientists and the modeling, and then they're putting in new information that they get from us here locally, plus from the state of Texas. That helps to drive the model. So we'll have opportunity to hear from them Friday, and that meeting will be, or that press conference will be at 5 o'clock, like we normally do. So stay tuned for that. That's great information to not only see what we can expect here in the coastal bend, but it also demonstrates to the community why, following the stay-at-home and social distance orders and other things that the federal, state, and local authorities have recommended we follow, why it really matters. And you can see, based on their predictive modeling that's based on science and fact, why it really does matter. And we know it's tough, but the models help to demonstrate the benefits of doing that. So that's Friday. So let's begin today on the COVID-19 test information for our community. And so every day at 4 o'clock, we look at the past 24 hours to see, are there new cases? What's the disposition of our patients that may be in the hospital? How many people have recovered? And so on. So as of 4 today, we have had 0 new cases in our county. So we still remain at 83 persons tested positive for COVID-19, 83 total persons. That's the same number that we had yesterday. As of today, there's still no deaths to report in Nueces County as a result of COVID-19. We have about 43 males that have COVID-19 and 40 females, so it's a pretty even split in the male-female distribution. We look at 9 different age groups to see who has COVID-19, and the report there is just about every age group has a similar or same number of persons that have the case of COVID-19. So the message is that this virus is not pick on one age over another age. Pretty much in our county anyway, there's a pretty equal distribution of those 83 across those 9 age groups. And then testing is another thing we report on daily. And an important reminder on testing, which is that we looked across the state of Texas to see, in our state at least, I'm not sure about the country, but the majority of testing done in the state of Texas is actually done by private laboratories. So labs like LabCorp and Quest Diagnostics. We are one of 10, our county, city-county health department is one of 10 state health authorities that help in helping the community in public health events like this. So when you look at it across the state, the public health labs are doing testing, but it's a very small number. And in fact, in Nueces County, we're doing almost 50% of all the testing. But when you look at the whole state, the picture is not that at all. It's that the private sector is doing like 90, 95, a large percentage. So just to point that out and just to let the community know that if you feel you're sick and you need a test, there's two ways of going about it. You can call our health district and see if you can get through our drive-through test site, but you should also, if you feel real bad, call your primary care physician to have them evaluate you and see if you are a candidate for a private test done at one of the hospitals that ultimately is done at one of the private laboratories, like a LabCorp or a Quest. So we want the community to know that our public health lab, which is one of 10 in the state, is not the only option to be tested, and that the hospitals test, your private doctor's offices can test, your primary care physician can ask for a test. But with respect to that, just to let the community know, in our county, between the city and then the private hospitals or the labs that are actually analyzing the test material, we had 1,177 tests that have been conducted. Let me report on two other statistics, which is persons in the hospital and then those that have recovered. We've been doing that since Monday. So of the 83 cases that we have today, 11 persons in our county have recovered from the COVID-19. So at this point, they're no longer contagious. In fact, some of them are donating their blood to help others with blood transfusion, plasma transfusions, to help them get better. And they're able to go back to work and generally be with other people that are no longer in quarantine. So 11 of the 83 are completely recovered. And in terms of those that are in the hospital who may still be part of that 83 that are not well enough to be at home recovering, there's only 3 in our local hospitals as of today. And none of those 3 are in an intensive care situation where they may be in an intensive care unit or be on a ventilator. So the 3 are not on either of those, either in an ICU unit or a ventilator. They are under general care in the hospital recovering. And so that number has dropped from, I think it was 6 earlier in the week or last week, down to 3. And we did have several on ventilators, and nobody is any longer on a ventilator, which is good. So that's the update on our statistics. Let me shift gears to talk about our first responders and then also our tribute that we have for first responders in our community. So when we first started dealing with COVID-19 in our community, just like everybody else across the country and world, we were practicing our EMS and police protocol were similar to the way they used to be prior to the COVID-19, but we slowly, or quickly I should say, changed, and as days progressed, we made even more and more improvements to protect our employees and protect the community. At some points in time along the way, we've had firefighters, police officers under quarantine, either because even with protective gear, they may have been exposed to somebody that had the COVID-19 virus. But as of today, we just want to remind the community there are 0 first responders in quarantine. That includes firefighters, paramedics, and police officers. We have none in quarantine, and nor do we have any civilian employees in quarantine. There was a case in our police department where we had a group of civilians that were exposed to a civilian employee that had COVID-19. And so no civilian employees are in a quarantine situation as well. And the reason I wanted to bring it up is one, to remind the community that we care about all of our employees, including our first responders, and we've done a lot to protect their health and safety in the communities. But also to say that the changes that we have made in the leadership of Chief Markle, our police chief, and Chief Rocha, our fire chief, the changes in the steadfastness in making sure incremental changes on top of the changes we have made are making a difference. We attribute the fact that we have 0 first responders in quarantine to the fact that our protocols are working and our frontline staff are adhering to those and following those. So at this point, did you want to do we're going to do a quick Spanish translation, and then I'll continue with our tribute to the first responders.
Desde el reporte más reciente no hay casos nuevos por el virus. Actualmente en el condado de Nueces existen 83 casos confirmados por el virus. Entre esos, 43 son varones, 40 son mujeres. La mayoría se encuentran en el rango de edades de entre 40 y 49 años. En total se han llevado a cabo 1,177 pruebas entre hospitales y el Distrito de Salud Pública. 11 de los 83 casos se han recuperado por completo, 17 han sido hospitalizados, 3 continúan en el hospital. La mayoría de las pruebas realizadas en el estado de Texas se realizan en laboratorios privados hasta en un 90%, pero es importante que la gente y que la comunidad sepa que si no califica para el Distrito de Salud, haga una prueba con el laboratorio privado. En cuanto al estado de los oficiales de policía de los bomberos, me da gusto reportar que no existe ningún elemento de primeros auxilios en cuarentena o bajo monitoreo. Tampoco tenemos empleados de la ciudad bajo cuarentena. Quiero agradecer al jefe de policía, Mike Markle, y al jefe de bomberos, Robert Rocha.
Okay. So, excuse me. So yesterday we announced an initiative that Councilman Ben Molina, City Council member from the City of Corpus Christi, City Council District 2, he wanted to see could we acknowledge our public safety first responders and our medical professionals by lighting up our harbor bridge in various colors that are consistent with their lines of business. And so we were able to do that, and last night was the first night that we had the bridge illuminated in red last night to show our support for our firefighter and paramedics. And I believe there's a picture here. Yep. So that'll be that was last night, and tonight will be red to acknowledge them. Thursday and Friday nights, the lights will change to an all blue lighting, and that's to salute our police officers, our sheriff deputies, and other law enforcement in our region. We want to thank them for dedicating their service, especially at times like this where they're at higher risk than normal. And then on the weekend, both Saturday and Sunday, the bridge will be completely illuminated in white, and that is to acknowledge our medical professionals out there. So those are our nurses, our doctors, and even our own medical staff that work in the city-county health district. We have over 100 employees that have public health as the primary focus every day when they're working for the city and county. So, and then Councilman Molina also said, hey, what about the 911 call takers? They are at a higher, they're spending more time and higher energy deciphering calls and making sure we get the right response out to somebody that's dialing 911. And so we are going to also extend this then on Monday and Tuesday. Their associated color is yellow, the 911 call taker. So when somebody calls 911, there's a live person that answers. That person we're honoring, as well as the person who dispatches the call. Once the call comes in, if somebody needs an EMS unit at the house, another staff member gets that EMS dispatch out to the house. So Monday and Tuesday will be to thank them. That is a very tough job. They're dealing with people's lives, and seconds matter, and so we want to acknowledge them as well. And then the last group we want to acknowledge at the request of Councilman Molina is our grocers, who are also on the front line every day, making sure we get food or prescriptions and other essentials that we buy from the grocery stores here in our city. So they don't have a recognized color, but we're working to maybe select green as the color for the grocers. And so we'll give you more information on that probably tomorrow or Monday, but keep an eye out for the bridge. I know we're not supposed to be out and about too much, but if you are, or if you see pictures, it's to help commemorate those first line persons that are helping us through this time. And I think for me, that is it for me for today. What we're going to do now is have Annette Rodriguez, our public health director, come up, and she's going to talk a little bit about the drive-through testing that'll take place tomorrow.
En cuanto al iluminado del Puente Harbor, comenzamos nuestra campaña para honrar a nuestros héroes locales. Por los próximos 6 días, las luces del Puente Harbor van a estar iluminadas de diferentes colores, honrando a los bomberos, policías y expertos de salud. La noche del día de hoy, el Puente Harbor va a continuar iluminado con luces de color de rojo para mostrar nuestro apoyo a los bomberos y paramédicos. El jueves y el viernes las luces van a estar iluminadas de color azul para agradecer a los oficiales de policía, así como a los despachadores del servicio 911 y a los delegados del condado. Durante el fin de semana, el sábado y el domingo, para honrar a nuestros profesionales de salud, las luces van a tornarse en color blanco, y también queremos agradecer a los empleados de las tiendas de comestibles. Aunque ellos no cuentan con un color, posiblemente escojamos el color verde. Ya se lo daremos a conocer.
Thank you. The next drive-through is scheduled for tomorrow, Thursday, April 16th at 8 a.m. This drive-through is a particularly important one. The Health District is pleased to announce that 6 individuals who have recovered have agreed to be retested in order to qualify for plasma donation. These individuals have fully recovered from COVID-19. One donation can save 2 to 3 critically ill persons' lives. We hope to continue to have recovered individuals donate plasma to ensure that any future critically ill COVID-19 patient receives this antibody-rich plasma. We are committed to continue to do our part and work with our community and the Coastal Bend Blood Center to prevent deaths. The Health District's Laboratory Response Network, LRN's main function is that it serves as a reference lab for a variety of high-consequence diseases such as anthrax, plague, Zika, MERS, and now COVID-19. In this pandemic, our laboratory serves as a backup for surge capacity needs for our first responders, our healthcare workers, physicians, and nursing homes that may have had potential exposures. Our laboratory response network has also very willingly assisted us with resulting tests for our drive-through clinics, but they also understand what their main function is, and if assistance for surge capacity is required, they may have to resort back to working fully in their primary capacity. The Health District prides itself in giving credible public health information to our community. We all reside in this community and want what's best for every one of our citizens. Thank you to all those who have supported the convalescent plasma program by donating blood, and to those who will donate in the future. A special thank you to our city and county public health staff for all your hard work and dedication. I am sincerely grateful to all of you. Stay well, stay home, and stay informed. Thank you.
En resumen, el próximo día de toma de muestras va a ser el 16 de abril. En esta ocasión, seis personas que se han recuperado se les va a tomar otra muestra para ver si califican para donación de plasma. Una donación puede salvar la vida de 2 a 3 personas. El Distrito de Salud continuará contactando a las personas que se han recuperado y tomará una muestra de sangre. Los pacientes que han recibido tratamientos por plasma ya no necesitan de un sistema de respiración artificial, lo que es muy buena noticia. Gracias a todas las personas que han donado sangre para el programa de plasma convaleciente. Y le quiero agradecer a todos los empleados de salud.
Okay, great. So that concludes our briefing today. It wasn't as long as our normal ones. Tomorrow, which is Thursday, we'll have County Judge Barbara Canales will be here, as well as City of Corpus Christi Mayor Joe McComb. They are coming to our press briefings both Tuesdays and Thursdays to talk about policy issues and other governance issues that impact the county and the city. And so we'll see them here tomorrow. And then as a reminder, Friday we'll be here, and with us will be our 2 individuals from Texas A&M University at Corpus Christi, Dr. Tussaud, and then Dr. Bird will be the presenter that'll talk about updated modeling. So both Annette and I are here. If there's any questions from the media, we can address those at this point.
Hello. Is the city or county considering stricter orders after seeing TAMUUCC's kind of curve flattening?
We not necessarily. So we're evaluating the next step. Right now, the orders go to April 30th, and you'll see on Friday from Texas A&M Corpus Christi a little bit different modeling. They're using updated information, and so the predictions may not look as bad. Our guide is going to be what the federal and state governments do in terms of relaxing or increasing orders. And so we'll begin to work too with the judge and the mayor looking at what we should do locally, but we'll follow, not follow, but we'll be guided by the governor and the president to see what they do nationally. And then here in the state of Texas, we still do have 15 days before the 30th gets here, so we have a little bit of time.
Mr. Zoney, a little recap of the last about the plasma.
Sure, the plasma?
Yes, sir.
Okay.
Right.
Oh, just a recap on the plasma. So the plasma actually is convalescent plasma. You take plasma from somebody that had COVID-19 and has recovered. And once they've recovered and they're symptom-free for 14 days, then they can go back through our drive-through or a commercial lab and get tested. Once they're negative, then they're eligible to donate blood to the blood bank. And then that blood is taken over to the hospitals to be used for other COVID-19 critically ill patients, kind of help boost their immune system and hopefully help them recover a lot faster.
As of now, how many people have pretty much?
We've had 4 people that have actually already donated in the past, and they have helped at least 3 individuals that I know of.
Thank you.
You're welcome.
Do you have any questions? Can you come over here? Just speak to the mic so I can hear it, please.
Do you feel that the numbers reported are accurately reflected? Because I know the city manager said that so many private labs are conducting the test. Is every single one of those tests administered in those private labs reported to you?
Absolutely. So every positive, so I'll say that, every positive, which is what is required by law, is reported to the health district. So yes, I believe it to be very, very accurate, so.
Do you feel enough people in Nueces County have been tested, or do you feel that more need to be tested?
You know, every day we're ramping up, so we're seeing more and more tested every day. So I like more testing because the more people tested, the more we know what we have in the population. But, you know, the resources are not completely there yet, and so we're just working the best we can with what we have at this point.
Also, I have a few Port Aransas-based questions.
Okay.
Can you tell me, we know that the first 2 were women. One was between 30 and 40, and the other was between 50 and 60. Can you give me those demographics for the other 4 cases in Port Aransas?
For the other 4 cases in Port Aransas, probably not off the top of my head, but I would say probably around the same age range for the others. And, you know, they're all very close-knit, so a lot of them were together, you know, this whole time. So when we report them out as person-to-person transmission because it was either family members or very, very close friends, so.
Can you talk about the citations over Easter? If there were any citations over Easter?
We don't have that information, but I think a good assessment would be there were probably very few, if any. Mike, we can get you the exact information for tomorrow, but I was in constant contact with Chief Markle over the 3-day period, the Friday, Saturday, Sunday, and he didn't report any to me. The goal of our police department was to encourage order through good communication. Our goal wasn't to cite or arrest unless warranted, but we'll get you maybe a follow-up tomorrow, but I think a good assessment for the immediate is that there are probably very few, if any.
Okay. Do you happen to know the ages of people still in the hospital?
The age of the 3 people in the hospital?
Between 40 and 90.
Okay, between 40 and 90.
Okay.
So there's only 3, but yeah, there is only 3, just as a recap. But, yeah.
Right. And the number of kit tests available?
So the quote-unquote kit test is kind of somewhat of a misnomer. There's several agents that are used to take the sample, the culture from the patient. That takes material, it takes a swab, it takes a carrying unit, and so on. Then when you take the test, when we actually conduct and analyze the test at the labs, there's several different agents that come in separately. They don't come in as a kit. So you could get one type of agent, but not 3 other types, and so on. So The message there and the follow-up from the gentleman in the blue shirt is that we are reliant on the federal government and then the state government to get our material. So we don't manufacture the material. We can't just go out and order some on Amazon or something like that. So we're reliant on what is sent to us. The testing model in America is a highly centralized one at the federal government level. And so through these public health labs such as ours, we're one of 10 in the state of Texas, we rely on the state and the federal government. And so one of the reasons where there's a pre-screening process to go through the city-county drive-through sites is because there's limited supplies. 2 weeks ago, we almost ran out of testing agents. So no matter how many swabs we had or cultures from persons, we couldn't have tested them potentially. But fortunately, we got a somewhat of a re-up in some of the supplies. So at this point, we're about 80, 90. We have enough material to test 90 specimens that we collect. So you can see that if we said, let's just test everybody, today we would only be able to test 90. So we do have ways to get more material. We have requests in through a state emergency management process. We have calls out to elected officials and so on, but we're somewhat at the mercy of the state government and the federal government to get those testing materials. But we do have enough to test the folks that go through tomorrow, and we should be getting some more supplies hopefully soon.
Okay. And so does the county have to get approval from Austin / the state to test someone, or is that just through?
No, do we, Austin or from the?
From the state, from the
Well,
state
let's
government?
have an answer that.
So up to 2 weeks ago, we had to get what you call a PUI number, person under investigation number from the state, the region actually, Department of State Health Services, but they've waived that since, and so now we do our own PUI number internally. We still have to give them the data though of who all we're testing, so
Okay.
yes and no.
And I guess while you're up,
That's okay.
do you know the amount of, and I'm very hydrochloric, one day I'll be able to say it correctly, but do you know the amount that y'all have in the county?
I think we have, we ordered 10 bottles for each hospital, so we actually received that through the STAR request, like the city manager mentioned, so we have 10 bottles in each hospital, so available for COVID-19 patients.
And do we know how much has been used on patients?
How much is used? You use 7 days worth, and so I'm not sure. in
Well, I
those-
guess a better way, have any patients been administered that as a treatment?
How many have been administered?
Yes.
I'd say quite a number already, but I couldn't give you the exact number. So
Okay.
the ones that were more critically ill, that were in ICU initially, those are the ones that actually get that medication.
Okay.
Since, give or take, there's 15 days left on what the governor put up, to reopen the state, and the president too. Do you think, with the low numbers here locally and in the county, do you think we're pretty much, fair to say, safe, on the safe side?
We're looking at those numbers very closely like everybody else, so we're hopeful. But we also know that, those numbers change from day to day. And so we're still looking at them, assessing, trying to get the best information that we can back to the community before those types of decisions are made.
All right, well, circling back to the hydrochloroquine, how many people can be treated with one bottle, would you guess?
With one bottle?
Yes, ma'am.
So I don't think they come in bottles like that. So I think you treat 7 days worth would be twice a day, and so 14 pills. So that's right. So 14 pills, and I think we have close to 500 pills per hospital. So we'd have enough for, I don't know, whatever the math is. Yeah, 20. So 20 individuals, for each hospital, something like that.
Okay, thank you.
Would you mind going over again what the necessary criteria is to be tested by the county?
Sure. The CDC guidelines. So if you're symptomatic and you've traveled to a place that has high infectivity, that's a reason to get tested. If you're symptomatic and you've been in contact with a COVID-19 positive person, that's another reason to be tested. If you're symptomatic and you have comorbidities, age 65 and older, or other comorbidities, obesity, diabetes, heart, cerebrovascular, whatever they are, that would be a reason. As well as if you're symptomatic and your reason for being symptomatic is unknown, that's another reason. Those 4 criteria. Thank you.
Okay, do we have any additional questions? Okay, good. Well, thank you for being here today. We'll be back again tomorrow at 5. Tomorrow joining us will be Nueces County Judge Barbara Canales and City of Corpus Christi Mayor Joe McComb. And then we do want people to tune in on Friday as well. We'll have 2 high-ranking persons from Texas A&M University Corpus Christi that are going to talk about updated modeling showing the curve for Corpus Christi and the Coastal Bend region in terms of number of cases projected, number of hospitalizations, and also they'll be projecting number of deaths. So we'll see you here both those days, tomorrow and Friday at 5 o'clock. Thank you.